Before we get into this story, I want to ask you two quick questions. If you enjoy true stories, unsettling tales, and mysteries that leave a lasting impression, subscribe to the channel now and turn on notifications. That way, you won't miss any stories that just beg to be told. And tell me in the comments, where are you watching this story from right now? The house stood on North 2nd Street in Atchison, Kansas, and didn't immediately stand out. Light wood, a narrow porch, symmetrical windows, an ordinary home in a quiet neighborhood where cars passed slowly and neighbors waved without curiosity. Yet something about that building seemed to resist time. It wasn't abandonment nor wear and tear. It was a contained presence, as if the house were always waiting for something no one could name. Lucas Harper arrived there believing in data, records, verifiable causes. A nurse recently transferred to the local hospital. He brought with him a routine marked by long shifts, physical exhaustion, and an almost stubborn trust in logic. He didn't believe in stories, nor in old small-town rumors. The house was cheap, well-located, and that was enough. On the other side of the narrative was Sallie House itself, not as an overtly mystical entity, but as a silent antagonist, a space that reacted, an environment that didn't need a human form to exert opposition. Its hostility wasn't immediately apparent. It emerged in small deviations, in almost imperceptible details that only accumulated when it was too late to ignore them. On the first night, nothing happened. Lucas slept soundly, lulled by the rural silence. On the second, he heard a dry crack coming from upstairs, similar to the sound of wood against wood. He attributed it to thermal expansion. On the third, he woke up with the unsettling feeling of being watched, even though the room remained plunged in still darkness. The conflict began without warning. There were no doors slamming or shadows on the walls. What there was a growing unease, translated into small events that refused to form a clear pattern. The radio would turn on by itself in the middle of the night, always on the same station, always at the lowest volume. The lights flickered only when Lucas crossed the narrow hallway that connected the bedrooms. Objects changed places enough to generate doubt, never certainty. The mystery took shape in the bathroom. After finishing a shower following an exhausting shift, Lucas noticed reddish marks on his abdomen. They were irregular lines, like superficial scratches, still warm to the touch. They didn't hurt, but they bothered him because of the lack of explanation. He ran his hand over them, trying to remember any sudden movement, any minor accident. Nothing. In the following days, the marks returned, never in the same place. Back, arms, thighs. They always appeared during the night, always without initial pain, only with a delayed burning sensation, as if the skin had been pressed hard enough to leave a mark. Lucas photographed them, compared angles, ruled out allergies, analyzed fabrics and detergents. No hypothesis held up for more than a few hours. The house responded to his skepticism with persistence. It didn't increase the intensity of the phenomena, it merely maintained its regularity. A sound here, a sensation there. The wall clock always stopped at 3:17. The hallway mirror reflected strange angles when glanced at, but corrected itself when looked at directly. Nothing explicit, everything suggestive. Lucas kept returning home. He kept sleeping there. Rationality didn't protect him. It only kept him trapped in the need for explanation. He didn't run away because he didn't believe there was anything to run from. And it was precisely this attitude that seemed to fuel the growing tension, as if the space demanded recognition. The doubt ceased to be external and began to settle within him. It wasn't fear yet. It was cognitive discomfort, the fracture between what one sees and what one accepts. The house didn't attack openly. It waited. And while it waited, it left its marks. By the end of that first week, Lucas understood something essential. It didn't matter whether Sallie House was haunted or not. The real problem was that events didn't need belief to exist. They simply had to happen. And they were happening. Atchison was a town that functioned on habit. Mornings began early, with the distant sound of metal doors opening at local businesses and delivery trucks scurrying along narrow streets. The Missouri River cut through the landscape like an ancient line, a silent witness to decades of history that were rarely revisited. There, the past wasn't denied, just avoided. Lucas began to notice this in the hospital corridors. Conversations would cease when he mentioned his address. There was no explicit disapproval, only uncomfortable silences, quick glances, and unnatural changes of subject. No one said the house was dangerous. They only said that it wasn't an easy place. Head nurse Margaret Collins was a partial exception. A woman of direct speech and firm posture, she had worked at the hospital for over 30 years. She knew every ward, every structural flaw in the building, every employee. When Lucas casually mentioned the marks on his skin, she didn't react with exaggerated surprise or open disbelief. She looked at the photos for a few seconds longer than necessary and returned the phone without immediate comment. Margaret didn't explain anything. She simply suggested he sleep in another room for a few nights. The recommendation came without medical justification, which made it even more unsettling. Lucas refused, not out of pride, but out of internal consistency. Changing rooms without proven cause was admitting an influence he refused to acknowledge. Outside the hospital, the house subtly integrated into daily life. The creaking of the floorboards accompanied her steps like a delayed echo. The faint smell of mildew appeared only on specific days, always when it rained. The staircase to the upper floor seemed slightly steeper at night, as if the steps required extra effort after sunset. Lucas began to observe the space with clinical attention. He measured distances, noted times, tested locks and windows. He bought simple motion sensors, installed more out of method than belief. None of them triggered when the marks appeared. None registered activity during the early morning hours. The history of the house was not unknown, only fragmented. Municipal records indicated a residence built at the end of the 19th century, occupied by a family connected to local medicine, a doctor, his wife, and a young daughter. Nothing unusual for the time. The name Sallie appeared only in informal notes, never in official documents. A curious absence for someone who, according to popular accounts, would have been too central to be ignored. The antagonism within the house didn't manifest as direct confrontation. There were no screams, apparitions, or open violence. What existed was a persistent feeling of being watched, reinforced by details that repeated themselves with unsettling precision. The guest room, always colder. The basement door, which insisted on not remaining fully closed. The slight unevenness in the living room floor, exactly where Lucas used to stop to take off his shoes. Secondary characters entered his life in a functional, almost bureaucratic way. The neighbor across the street, a gentleman named Thomas Reed, avoided prolonged eye contact. He greeted politely, but never crossed the street to chat. The owner of the local grocery store, Helen, always asked if he was adjusting well, but never waited for a complete answer. These interactions, however brief, created a backdrop of collective restraint. The city knew more than it let on. Not out of malice, but for social survival. In Atchison, certain questions were not asked because answers demanded consequences. Inside the house, time seemed to behave erratically. Lucas began to notice strange lapses. Moments when he would sit down to rest and, upon looking at the clock again, discover that hours had passed. There was no mental confusion or signs of extreme exhaustion, just silent gaps with no associated memory. The marks kept appearing, now accompanied by clearer sensations, pressure, localized heat, a clear impression of contact, even though no movement was remembered. The absence of immediate pain made everything more disturbing. It was as if the body reacted before the mind. At that point, Sallie House was no longer just a setting. It had become an active system, influencing behaviors, shaping decisions, and defining invisible boundaries. Lucas still didn't see it as an enemy, but he could no longer treat it as neutral. Something in that space interacted with him in a consistent, selective, and insistent way. And for the first time, a question arose that he had avoided until then. Why only him? The conflict ceased to be abstract when it began to directly interfere with Lucas's routine. What had previously manifested only at night began to infiltrate the intervals of the day, creating a disturbing continuity between the space of the house and the outside world. The separation between work and rest slowly dissolved, as if something were being carried along with him. At the hospital, Lucas began making small mistakes. Nothing serious, nothing that would put patients at risk, but enough to draw his own attention. He forgot supplies, mixed up schedules, and took a few extra seconds to answer simple questions. His mind remained functional, but constantly occupied with trying to organize events that refused to follow a clear logic. The marks became more defined. They were no longer just irregular lines. Some took on almost symmetrical shapes, as if fingers had pressed the skin hard enough to leave light bruises. One morning, looking in the bathroom mirror, Lucas found 5 circular marks on his left shoulder, arranged almost deliberately. There was no pain, just the uncomfortable certainty that this was not random. He began to sleep less, not out of conscious fear, but out of involuntary vigilance. His body remained tense, even when exhaustion finally led him to sleep. And it was in these short, fragmented periods that events intensified. Sounds of footsteps in the upstairs hallway, the dry creak of the stairs, the unmistakable feeling of weight at the foot of the bed, as if someone had sat there for a few seconds before getting up. Lucas reacted methodically. He installed additional cameras, this time covering the bedroom and the hallway. He adjusted sensors, tested angles, and reviewed recordings every morning. The images showed exactly what one would expect: empty hallways, motionless doors, no shadows out of place. Still, the marks kept appearing. Technology didn't contradict experience. It simply refused to explain it. The antagonism within the house took on a new layer when objects began to directly interfere with his body. One night, upon waking abruptly, Lucas felt intense pressure on his wrist, as if something were holding it. His reflex was immediate. He pulled his arm away, sat up in bed, his heart racing. There was nothing there. However, the mark appeared minutes later, a purplish band encircling his wrist with almost clinical precision. Secondary characters began to be drawn into the conflict, albeit indirectly. Margaret noticed the change in him before anyone else. His more tired look, his overly calculated movements, his excessive attention to irrelevant stimuli. When she insisted on knowing if he was sleeping well, Lucas responded evasively. He didn't want to verbalize something he hadn't yet fully accepted. The internal conflict wasn't one of belief versus disbelief, but of control. Lucas felt he was losing control over his own body and the space he occupied. The house didn't seem to react to fear, but to resistance. The more he tried to impose logic, the more events organized themselves into subtle patterns, almost like responses. The city also began to react. Neighbor Thomas started avoiding leaving the house when Lucas was outside. Helen, at the grocery store, stopped asking questions. The isolation wasn't imposed, it was a consequence. His presence, associated with the house, became an uncomfortable reminder of something everyone preferred to keep at a distance. The tension reached a new level the night Lucas woke up struggling to breathe. It wasn't sleep paralysis. He could move, talk, and stand up. Still, he felt a constant pressure on his chest, as if air were being pushed out of his lungs. The sensation lasted only a few seconds, but it was enough to leave a large, dark, deep mark in the center of his chest, like an old bruise. That morning, Lucas didn't try to rationalize immediately. He sat on the floor of his room, leaning against the cold wall, silently observing the house. For the first time, he wasn't looking for external explanations. He simply recognized the progression of events. Something was approaching a breaking point. And intuitively, he knew that the conflict wouldn't remain contained for much longer. Sallie House wasn't just reacting to his presence, it was escalating. The escalation of events forced Lucas to do something he had been avoiding from the beginning, to involve other people more directly. Not in search of spiritual help or emotional validation, but out of practical necessity. He needed context, information, patterns that didn't depend solely on his own perception. The first subplot emerged from Margaret. After a particularly long shift, she called him to the break room, away from prying ears. There was no dramatization, just a sequence of facts presented with excessive care, as if each word could displace something out of place. Margaret recounted that it wasn't the first time a healthcare professional had lived in that house, nor the first to leave earlier than expected. Some had requested transfers. Others had simply disappeared from the city's routine. She offered no supernatural explanations. She limited herself to loose data, fragmented memories, events that had never been officially recorded. The pattern was unsettling precisely because of its silent repetition. People connected to physical care, to medicine, to bodily intervention. People who touched vulnerable bodies during the day and returned home at night. This information brought no relief. It merely shifted the conflict to a new level, that of possible intentionality. Sallie House did not react randomly. There was a criterion, still obscure, but consistent. Another subplot formed from historical records. Lucas began frequenting the local library during quieter times. He searched through old newspapers, personal diaries donated by families in the area, and outdated medical records. The name Sallie was still absent from formal documents, but it appeared in marginal notes, personal letters, and handwritten comments. What emerged from these readings was not a clear narrative, but a set of contradictions. Some versions spoke of a sick child, others of a patient who never officially lived in the house. There were mentions of medical procedures performed inside the residence, something common in the 19th century, but described with an unusual level of urgency and improvisation. These findings did not explain the marks, but they added weight to the idea that space held bodily memories. The main conflict, previously centered on Lucas's physical experience, began to intertwine with a history of unresolved, albeit poorly defined, pain. The temporal pressure arose organically. The marks began to appear more frequently. They were no longer isolated nocturnal events. Sometimes they appeared during brief naps on the sofa. Other times, after periods of continuous wakefulness, without any loss of consciousness. The body reacted independently of the state of alertness. Meanwhile, the house began to restrict his options. Electronic devices would malfunction only when he tried to search for the address. The cell phone signal would drop in certain rooms. The basement door started opening on its own during the early morning hours, requiring Lucas to close it repeatedly, always encountering mechanical resistance that was non-existent during the day. A third subplot involved his own behavior. Lucas began to move around the house differently without realizing it. He avoided certain hallways. He quickened his pace when climbing the stairs. He slept with the lights on, not out of explicit fear, but out of a need to define his space. The house shaped routines, imposed trajectories, created zones of comfort and tension. All these narrative threads converged on the same point, the feeling that the conflict could no longer be contained merely through passive resistance. Something demanded a response, not an immediate escape, but a conscious choice. Remaining inactive became, in itself, a form of action, and one that seemed to favor the progression of events. The subplots didn't divert the focus. They compressed it. Lucas's personal history, The fragmented past of the house and the complicit silence of the city formed a closed system, pressured by time. And as the boundaries narrowed, it became clear that the next stage would not be gradual. It would be a breakup. The breakup happened abruptly, without the gradual build-up that had marked previous events. There was no warning, no psychological preparation, just a clear change in the dynamics of the house, as if something had decided that the observation phase was over. Lucas woke up in the middle of the night to the sound of something falling downstairs. It wasn't a crack or the usual creaking of wood. It was a dry, heavy impact followed by absolute silence. The clock read 3:17 a.m. Unlike other times, he didn't remain motionless. He stood up immediately, feeling an urgency that didn't stem from fear, but from an unsettling certainty. If he didn't go downstairs at that moment, something would be irreversibly lost. He grabbed his cell phone, turned on the flashlight, and left the room. The room was different, not physically altered but displaced. The air seemed denser, difficult to pass through. The lamp, which he always left off, was lit, emitting a weak light that didn't reach the corners of the room. In the center of the room, on the rug, was the small cabinet that had been in the hallway, tilted on its side, with the door open. Inside, scattered on the floor, were objects he had never remembered storing there. Ancient medical instruments. They were neither replicas nor decorative pieces. Lucas immediately recognized the function of each one, despite their outdated design. Short-bladed scalpels, thick tweezers, a rudimentary retractor. Tools bearing marks of real use, dark stains embedded in the metal, impossible to remove completely. He took a step back. The movement was interrupted by a sudden pain in his abdomen, intense enough to double him over. The sensation wasn't of a cut, but of internal pressure, as if something were being pushed against him from within. When the pain subsided, it left behind a deep, irregular mark, darker than any other that had ever appeared before. Lucas understood at that moment that the marks were not random attacks, they were repetitions. The turning point solidified when he went down to the basement for the first time since moving in. Not out of curiosity, but because he felt, with uncomfortable clarity, that this was where the logical progression of events was leading him. The door, which had previously resisted, opened effortlessly. The basement wasn't empty. There were no people, but there were clear signs of recent occupation. Dust had been removed from specific areas. A thin mattress leaned against the wall, and in the center of the space, an improvised table, stained, with marks that were not just from time. Lucas approached slowly. As he touched the surface of the table, a sequence of images flooded his perception, not as memories, but as bodily sensations. Sharp pain, restricted movement, shortness of breath, hands gripping with excessive force. There was no face. There was no voice. Only the body being restrained. He immediately pulled his hand away, breathless. The cell phone fell to the floor, its power dying on impact. In the near-total darkness, the house seemed more present than ever, not as a physical space, but as an active memory system. The revelation didn't come in words, but in stark understanding. Sallie House didn't reproduce violence out of sadism. It reproduced procedures. It reenacted physical experiments that had occurred there repeatedly on vulnerable bodies. And Lucas wasn't being chosen at random. He was functional. He knew how to touch, measure, restrain. His body and his profession made him compatible with what the space insisted on reliving. When he managed to climb back up trembling, the hallway mirror reflected something different. For a brief second, he saw marks that weren't his, small, more fragile, scattered across a child's body that wasn't really there. The turning point came with a certainty that was impossible to ignore. The household didn't want to kick him out. I wanted him to participate. After that night, the house stopped acting indirectly. There were no new displaced objects or ambiguous sounds. The change was more unsettling. a constant feeling of expectation, as if the space were waiting for an answer that had not yet been given. Lucas spent the following day in a state of autopilot. At the hospital, he performed tasks with almost excessive precision, compensating for exhaustion with rigid focus. However, something within him had changed. His hands, once steady, now hesitated for fractions of a second before touching patients. The bodily memory from the basement insisted on interfering, superimposing images that were not personal memories, but sensory echoes. The marks had also changed. They no longer appeared abruptly. Now they appeared slowly, accompanied by progressive sensations of pressure and heat, as if the body were being prepared for something bigger. Lucas began to recognize temporal patterns, always after touching someone in a vulnerable state, always after more invasive procedures in the hospital. The most immediate consequence was a change in the relationship between him and his work. The care, previously mechanical and professional, became fraught with tension. He avoided prolonged contact. He reduced interactions to the bare minimum. The house seemed to respond to this resistance with an increase in the clarity of nocturnal sensations, no longer random, but almost instructive. Margaret was the first to confront him directly, not with accusations, but with objective observations. She said he was too distant for someone who needs to touch people every day. The simple phrase struck Lucas harder than any physical mark. He didn't respond. He simply realized that the house was interfering not only with his body, but with his professional identity. Inside Sallie House, the atmosphere became more stable, almost organized. The basement door remained open. The guest room was no longer cold. The radio no longer turned on by itself. Instead, small adjustments to the space emerged, always related to functionality. Surfaces cleaned without explanation, objects positioned in an accessible way, as if someone were preparing the place for continuous use. Lucas reacted with psychological retreat. He started sleeping on the sofa, away from the master bedroom. He kept all the lights on at night. He avoided entering certain rooms, especially the basement. Even so, the feeling of being summoned persisted, not as a threat, but as an insistence. The city reacted in silence. The isolation became more explicit. Invitations ceased. Conversations were interrupted when he approached. The association between Lucas and the house seemed definitive. There was no open hostility, only a collective retreat, as if everyone were waiting to see the outcome before taking a stand. Physically, his body began to show signs of wear and tear. The marks took longer to disappear. Some left light scars. The absence of immediate pain continued, but now it was accompanied by a delayed sensation of profound fatigue, as if parts of his body were being used without conscious consent. The most significant emotional reaction was the breaking down of denial. Lucas no longer sought alternative explanations. He didn't research medical causes. He didn't test sensors. He accepted, even without verbalizing it, that something in the house operated according to its own logic, and that this logic included him as an active element. This acceptance did not bring relief. It brought burden. The ultimate consequence of that turning point was the realization that neutrality was impossible. To remain in the house without acting was to allow it to lead the process. To leave without understanding would be to abandon something unfinished, possibly transferring the conflict to another body, another occupant. Lucas was caught between two conflicting responsibilities: protecting himself and not repeating through inaction what the place seemed to be reenacting, and the house, silent, seemed willing to wait only for a limited time. Overcoming the challenge didn't begin with explicit courage or a heroic decision. It began with adaptation. Lucas understood in a practical way that directly resisting the house only reinforced the cycle. Ignoring it didn't work either. The only possible path seemed to be conscious confrontation, not of the entity, but of the repeating process. He began to observe the reactions at home with the same rigor he applied in the hospital. He didn't seek to eliminate the phenomena, but to understand their triggers. He noted the times, physical sensations, types of marks, and most importantly, what he had done before each episode. Gradually, a pattern became impossible to ignore. The further he distanced himself from human care, the more intense the manifestations became. The house didn't demand pain, it demanded function. This realization marked the beginning of a behavioral change. At the hospital, Lucas began to approach patients more consciously again. He didn't prolong procedures, he didn't dramatize touch, but he stopped avoiding it. He adjusted sheets carefully, maintained eye contact for longer, and explained actions even when it wasn't strictly necessary. Small gestures that reintroduced humanity to the technical process. The consequences were immediate. The marks didn't disappear, but they became less aggressive, more superficial. Some nights passed without new marks on the skin. The tiredness persisted, but without the feeling of complete emptiness. The house reacted to the change with restraint, as if it were assessing the consistency of this new behavior. Inside Sallie house, Lucas began to reclaim spaces he had abandoned. He returned to sleeping in the master bedroom. He walked down the upper hallway without quickening his pace. He went down to the basement during the day, just to stay there for a few minutes, observing the surroundings without touching anything. There was no explicit challenge, only presence. This growth wasn't linear. There were relapses, nights when he woke up with pressure in his chest, mornings when new marks appeared without warning. But the difference was in his reaction. He no longer panicked or sought to escape the experience. He treated the events as signs of incomplete adjustment, not as punishments. The personal transformation also became visible to others. Margaret noticed the change in his pace, in the way he occupied spaces. She commented indirectly that he seemed more present. The simple phrase confirmed something Lucas already suspected. Conflict didn't require sacrifice, but integration. The growth culminated in the most difficult decision yet. Lucas returned to the library and revisited the historical records, this time with a different focus. He wasn't looking for culprits or medical explanations from the past. He sought to understand the central flaw, the absence of choice, the imposition of the procedure, the reduction of someone to a functional body. He began to realize that Sallie House reenacted not only physical pain, but the denial of agency. The space preserved a logic in which the body was used, contained, manipulated, without consent, without a voice. And there lay the fundamental difference. Lucas began to take an active role within the house. He spoke loudly, not to provoke, but to declare his intentions. He announced when he entered the basement. He said when he was leaving and when he would return. He didn't ask for permission, but he acknowledged presence. These simple actions, subtly yet consistently, altered the dynamics. Overcoming it didn't mean conquering the house. It meant ceasing to be controlled by it. By the end of that period, Lucas was no longer the same professional who had arrived in Atchison. Nor was he the same skeptical resident who had rented the house out of convenience. He possessed a heightened awareness of the weight of touch, of the responsibility involved in caring for vulnerable bodies, and of the consequences of ignoring it. The house remained active, but now, for the first time, it seemed to respond to him as an equal in the process. The calm that settled in after Lucas's change of attitude didn't bring a sense of closure. It was a functional truce, sustained by a fragile balance. The house remained silent, but the silence wasn't empty. It was concentrated, as if something were being held in suspension. The subplots began to resolve themselves discreetly. Margaret, without formal explanations, adjusted Lucas's shifts, reducing his exposure to more invasive procedures. The change wasn't presented as a favor, but as an administrative necessity. Even so, the impact was clear. Fewer scars, fewer episodes of extreme exhaustion. The city, in turn, maintained its distance but ceased its active isolation. The conflict stopped being an avoided topic and became accepted as part of the environment. Inside Sallie House, the space began to behave like a residence again, at least on the surface. Doors remained where he had left them. Objects didn't move. The radio remained off for days on end. However, certain details indicated that the process was not yet complete. The basement remained overly organized. The table remained clean, as if awaiting future use. Tension rose again when Lucas realized the manifestations had become selective. They no longer affected his body directly. Instead, they appeared at specific, almost ritualistic moments. Whenever he tried to completely ignore the house's past, whenever he considered, even for a moment, simply leaving. The time pressure intensified when Lucas received a concrete transfer offer, another hospital in another state, better salary, reduced working hours. The offer represented a clear, rational, and safe way out, and precisely for that reason, it triggered an immediate response from his employer. That night, for the first time in weeks, the clock stopped again at 3:17 a.m. The radio turned on by itself, not playing music, but emitting low, steady static. As he walked down the hallway, Lucas felt a light pressure on his arm. Not enough to leave a mark, but faint enough to be perceived as deliberate contact. The house didn't want him to leave without completing the cycle. Lucas understood with growing discomfort that preparing for the climax didn't require immediate physical action, but an ethical decision. Staying meant taking responsibility for something he hadn't started. Leaving meant accepting that the pattern would repeat itself with another occupant, possibly less attentive, less willing to interrupt the old logic. He went down to the basement that morning and stayed there for hours. He didn't touch the table. He didn't arrange any instruments. He simply remained present, observing, as if awaiting an answer that had yet to take shape. For the first time, he sensed something different about the house, not hostility nor functional expectation, but urgency. The climax was approaching not as an explosion, but as a convergence. All the narrative threads, the scarred body, the fragmented past, the function of care, the refusal to repeat violence, pointed to a single decisive moment. Lucas would have to act decisively, not to escape, but to conclude, and the house, silent and attentive, seemed ready to accept only one last interaction. The decision wasn't accompanied by moral clarity or a sense of rightness. It came as a functional necessity, just like so many difficult decisions in the hospital, when inaction meant causing greater harm. Lucas accepted this as he walked down the dark corridor for the last time that morning. The clock showed 3:16 a.m. He went down to the basement carrying only a flashlight and a thin folder he had prepared during the day. Inside, there were no instruments or medical notes, only copies of historical records, newspaper clippings, digitized personal letters, imperfect fragments of a history that had never been officially acknowledged. The table was there, motionless, silent. Lucas positioned the flashlight to illuminate the center of the room and, for the first time since arriving home, spoke without measuring his words or intentions. He did not announce any procedures. He did not describe any actions. He didn't try to explain. They are lions. He read the passages that mentioned a child without a last name. He read the letters that spoke of medical emergencies within the residence. He read the contradictory accounts, the omissions, the silences. He gave verbal form to what had always been treated only as function and body. As the words echoed in the basement, the house reacted, not with violent noises, but with clear physical changes. The air pressure increased. The ground seemed to vibrate slightly beneath his feet. Lucas felt the same sensation of restraint he had experienced so many times, but now distributed, diffuse, without a fixed point. There were no invisible hands. There was total presence. The clock showed 3:17. The pressure converged. Lucas fell to his knees, not from pain, but from sheer weight. His body responded with immediate marks, not isolated but connected, forming an irregular map on his skin. For the first time, there was real pain, intense, brief, enough to take his breath away. He didn't scream. He continued reading. The twist became apparent at that moment. The marks that were now appearing did not correspond to known medical procedures. They were not repetitions. They were variations, adjustments. The house was not merely reenacting the past, it was reacting to the disruption of the pattern. Lucas understood too late that the climax required more than just historical recognition. It demanded a final choice. He closed the folder and did something he had never done before. He refused the task. He said aloud that he would not touch, restrain, or intervene, that he would not complete any procedure, that the house could preserve the memory, but not his body as a means to that end. The impact was immediate. The pressure ceased abruptly, throwing him forward. The flashlight went out. In the absolute darkness, Lucas felt something different from previous sensations, not contact, but separation. As if something were being pulled from space. When the lights came back on, the basement had changed. The table was empty, clean, spotless. The instruments were no longer there. Where marks always appeared on his skin, there was nothing new, no pressure, no heat. But the mirror leaning against the wall, which he didn't remember seeing before, reflected something impossible to ignore. Old, scarred marks scattered across a body that was no longer his. The household was not satisfied. It was closed. The climax ended with the disturbing realization. Sallie House didn't need to continue. I needed to stop. And in doing so, she not only freed herself, she removed Lucas from the cycle permanently. The clock started working again. It was 3:18 a.m. The house didn't transform after that night. There was no structural collapse, no sudden change in atmosphere, nor any immediate sense of relief. What occurred was more subtle, and precisely for that reason, definitive. Sallie House became just a house. Lucas realized this in the following mornings. The silence no longer carried any expectation. The rooms responded only to physical presence, without any invisible resistance. The basement remained closed, not by external force, but because he chose not to go down again. There was nothing left to close there. The marks on his body gradually disappeared. Some left light, almost imperceptible scars that didn't follow any pattern. They weren't clear memories, but physical records of a completed process. The tiredness persisted for weeks, but without the feeling of emptiness that had accompanied him before. His body was once again exclusively his. At the hospital, the change was noticeable in a practical way. Lucas resumed his full duties, now with a different attitude towards care. There was no dramatization or excessive guilt. There was awareness. He began to refuse unnecessary procedures, question old protocols, and insist on clear explanations to patients, even when this delayed routines. Margaret never asked what had happened that night. She simply observed. On one of her last shifts before the final move, she commented that the house seemed lighter when passing by North 2nd Street. The statement wasn't accompanied by emotion, just an observation. The city reacted slowly. Sallie House ceased to be mentioned in interrupted conversations. The address reappeared in real estate ads, now without awkward pauses. Still, no one seemed eager to occupy it. The past hadn't been erased, just closed sufficiently so as not to require repetition. Lucas refused the immediate transfer. He remained in Atchison for a few more months, not out of attachment to the house, but out of a personal need for stability. When he finally moved, he left the property empty, clean, with no forgotten items, no attempt at a symbolic farewell, just a functional closure. The conclusion did not bring a sense of victory. It brought acceptance. The conflict had not been won, but resolved within the limits of what was possible. The past remained the past. The present ceased to react to it. Sallie House was neither cleansed nor absolved. He simply stopped demanding it. And for Lucas, that was enough. Years later, a new entry surfaced in Atchison's real estate files. Sallie House had been sold again. The inspection report made no mention of structural flaws or irregularities. It merely noted that the house remained quiet, stable, and ordinary. The new resident never reported any marks, sounds, or lapses in time. Even so, he avoided the basement without being able to explain why. In another state, Lucas continued working in the healthcare field, now involved in reviewing ethical protocols. On his desk, he kept a single old photograph of the house, not as a memento but as a reference. Some stories don't need to continue, they need to finish at the right time. Stories like that of Sallie House are sustained not only by fear, but by the questions that remain after the last paragraph. What happens when spaces preserve memories that no one wanted to acknowledge? To what extent is repeating a pattern more comfortable than interrupting it? If this narrative provoked discomfort, reflection, or unease, share your impressions. Discuss the role of responsibility, silence, and ethical choices in the face of the unknown. Each reading adds a new layer of meaning to what was told, and to what was left implicit. Some stories end on the page. Others continue in the way we choose to act afterward.